My name is Sophia Fantus, and I'm an assistant professor in the School of Social Work at the University of Texas, Arlington. In honor of Minority Mental Health Awareness Month, I'm here to tell you a little bit about conversion therapy, or perhaps better known as reparative therapy, among LGBTQ+ youth. Conversion therapy is an umbrella term that refers to dangerous, discredited, and harmful practices that use physical, emotional, psychological, and cognitive abuse in order to fix or repair a person's sexual or gender identity. Texas is one of the biggest providers of conversion therapy, where it is illegal for licensed healthcare providers to practice under a false belief that LGBTQ+ people are abnormal and need to undergo treatment to change in order to become straight. Procedures may include cognitive rethinking, re-education, electric shock therapy, nausea-inducing drugs, and have even included chemical castration. The aim of this approach is intended to make LGBTQ+ people feel shame. It is grounded in negative social attitudes against LGBTQ+ people, as well as institutional barriers that have failed to protect the rights of LGBTQ+ populations. It dates back to the pathological depiction of homosexuality when it was placed in the Diagnostic and Statistical Manual of Mental Disorders, the DSM, before it was removed in 1973. Repeated studies and anecdotal reports suggest that conversion therapy has incredibly harmful effects on LGBTQ+ youth, including higher rates of shame, depression, isolation, internalized homophobia or self-hatred, anxiety, trauma, drug and tobacco use, homelessness, as well as suicidal ideation, attempts, and completions. Conversion therapy has been opposed by virtually all major medical and mental health organizations across the United States. Yet, conversion therapy among minors has only been banned in 20 states and only across some major cities. Hundreds of thousands of people have been forced into conversion therapy as children, and as of 2019, an estimated 2,372 Texas youth between the ages of 13 to 17 were subject to conversion therapy before even reaching the age of 18. Conversion therapy has become subtle, redirecting LGBTQ+ behaviors and attractions under a guise of care and compassion. I encourage you all to become more informed about conversion therapy and to seek out ways to help LGBTQ+ youth. We have to consider approaches that create affirming, inclusive, and ethical health and mental health practices that aim to foster resilience. Thank you.